In the 1970s, medicine felt different. Doctors smoked in their offices. Pharmacies handed out drugs with little warning. Labels were simple. Side effects were rarely discussed, and trust in authority was absolute. If a doctor prescribed it, people took it, no questions asked. What no one realized back then was that many of these normal medicines were quietly damaging bodies, altering minds, and in some cases, destroying lives. Looking back now, it feels unbelievable. But in the 1970s, these drugs weren't controversial, they were routine. This is the story of 25 medicines that were once completely normal but are illegal, restricted, or heavily controlled today. One of the most common drugs of the 1970s was quaaludes, officially known as methaqualone. Quaaludes were prescribed for insomnia and anxiety. Doctors believed they were safer than barbiturates. In reality, they were highly addictive, dangerously sedating, and often mixed with alcohol. By the late 70s, abuse was widespread. Emergency rooms filled with overdoses. Today, quaaludes are illegal in most countries and classified alongside the most dangerous narcotics. Another drug doctors freely prescribed was phenacetin, a common painkiller found in headache and cold remedies. It worked well, but it quietly destroyed kidneys and increased cancer risk. Millions took it without knowing the damage it caused. It was eventually banned in many countries after overwhelming evidence linked it to renal failure. In the 1970s, heroin was still legally prescribed in limited medical settings in some countries. It was once considered a legitimate pain treatment and cough suppressant. By the time governments fully understood its addictive nature, entire communities were already affected. Today, heroin is illegal almost everywhere. Barbiturates were another staple of 1970s medicine. Doctors prescribed them for sleep, anxiety, seizures, and stress. They were effective but incredibly dangerous. Overdose risk was high, especially when mixed with alcohol. Thousands died. Most barbiturates have since been replaced by safer alternatives and are now tightly restricted or banned. One of the most shocking examples is difostilbestral, known as DAY. It was prescribed to pregnant women to prevent miscarriage. Doctors believed it was safe. Years later, children exposed in the womb developed rare cancers, fertility problems, and birth defects. DAY is now banned for use in pregnancy. In the 1970s, amphetamines were commonly prescribed for weight loss, depression, and fatigue. Housewives were given diet pills that were essentially speed. Long-term use led to addiction, psychosis, heart problems, and emotional collapse. Today, these drugs are strictly regulated. Another once normal drug was chloramphenicol, a powerful antibiotic. It saved lives but also caused fatal bone marrow failure in some patients. Because safer antibiotics exist, its use is now extremely limited. Thalidomide still lingered in limited use in the early 70s, despite its devastating history. Originally marketed as a sedative and morning sickness cure, it caused severe birth defects. While it is now used only under strict controls for specific conditions, its earlier widespread use remains one of medicine's darkest chapters. In the 1970s, cough syrups often contained codeine in high doses. Children and adults alike took it without concern. Addiction and respiratory depression were common but poorly understood. Today, many codeine products are banned or prescription only. Another forgotten danger was lead-based medicines, especially topical treatments and home remedies. Lead was still present in some pharmaceutical products. Chronic exposure caused neurological damage, especially in children. These products are now completely illegal. Mercury-based compounds were also widely used. From antiseptics to laxatives, mercury was considered therapeutic. Long-term exposure led to tremors, memory loss, kidney damage, and insanity. Modern medicine recognizes mercury as a toxin. In the 70s, benzodiazepines like Valium were marketed as miracle cures for stress. Doctors prescribed them casually, especially to women. Dependency, withdrawal, and emotional numbness followed. While not illegal today, their use is now heavily controlled due to widespread harm. Methamphetamine was legally prescribed in tablet form for obesity and depression. It was sold under brand names and trusted as medicine. Today, it is classified as a highly dangerous, illegal drug. Another disturbing example was arsenic-based treatments used for skin conditions and infections. While effective against some diseases, Arsenic accumulated in the body and caused cancer and organ failure. In the 1970s, Letrol, an alternative cancer treatment derived from apricot pits, gained popularity. It was promoted as natural and safe. In reality, it released cyanide in the body. It is now illegal in many countries. PCP, originally developed as an anesthetic, was used medically before its severe psychological effects became clear. Patients experienced hallucinations, paranoia, and violent behavior. It is now illegal. Some cold medicines contained ephedrine in high doses. While effective, it caused heart attacks, strokes, and addiction. Today, it is tightly regulated. Chloral hydrate, a sedative prescribed even to children, caused respiratory failure and dependency. It is rarely used now. In the 70s, cocaine was still present in some medical products. It was even used by dentists and surgeons. Addiction and abuse led to strict prohibition. Dinitropena, a weight loss drug, increased metabolism but also caused fatal overheating. It is now illegal. Phenylbutazone, a painkiller used for humans, caused fatal blood disorders. It is now restricted mainly to veterinary use. Ergot-based drugs, derived from fungus, were used for migraines and childbirth. Overuse caused hallucinations, gangrene, and death. Hexatropane, an antibacterial soap ingredient used on babies, caused brain damage. It is now banned. Finally, radioactive medicines, yes. Radioactive war, once prescribed for pain and vitality. Long-term exposure led to cancer and radiation sickness. Looking back, the 1970s were not reckless by intention. They were limited by knowledge. Science was still catching up. Regulations were weaker. Trust was absolute. People didn't know the risks. They trusted the system. They trusted the white coat. Today, these drugs are banned. Not because society became fearful, but because it became informed, and it raises a chilling question. Which medicines we trust today will future generations look back on in disbelief?